Overwhelmed, the word out of the island's biggest hospital this evening, Kingston Public Hospital, as it relates the crisis crime has spawned for its operations.
Just this morning alone, 18 people turned up with gunshot wounds, and that's just the beginning. In just 6 months, there were 433 gunshot cases and stab wounds and over 1,000 accident cases.
Health Minister Dr. Kingston outlined the problem and what has to be done, including focusing on emergency cases. TVJ's Vashan Brown picks up the story.
2017 is turning out to be a stressful year for doctors, nurses and other medical staff. As more people get seriously injured, there is increased demand for medical treatment, more equipment, more doctors to operate on wards and so on. Since 2017, the Kingston Public Hospital has seen 433 gunshot cases, 183 stab wounds and over 1,000 accident cases. Health Minister Dr. Christopher Tufton describes this as a serious problem.
The cost and the time, the equipment, the expertise, the effort associated with treating these trauma cases have been significant and has created a stress on the institution, which we are trying to cope with. The high point over the last 24 hours, according to the staff here, they have had to treat with some 18 gunshot wounds.
The hospital is also running out of bed space as a result of the increase in emergencies, with over 520 patients needing beds, but a capacity of 475. Senior Medical Officer at the KPH, Dr. Natalie Wiley, says over the past 24 hours, operations have changed significantly.
And one theatre has been reassigned to address the dire surgical emergencies that we expect to come in. It also has had some implications for accident and emergency unit, because if we have 475 beds and we have 521 patients, then our stretchers from the accident and emergency unit have had to be utilized to act as beds.
Some patients will now be transferred to several hospitals in the corporate area: the Victoria Jubilee Hospital, the University Hospital, the National Chest Hospital and the St. Joseph's Hospital.
What we have to do, therefore, is to view the institutions, the inpatient institutions in the corporate area as essentially one unit, different areas of specialization, and the extent to which we can move around logistically to cope with the additional pressure. We're going to have to engage in that exercise over the next now to try and take some of that burden off.
Dr. Tufton says even as the government tackles the crime fight, the public can do more.
If Jamaicans were to all band together to do more to, one, resolve differences without resorting to violence, taking better care on the roads, and therefore avoiding or minimizing the need to seek treatment for trauma-related cases based on accidents.
Vashan Brown, TVJ News.